Okay, the anatomy of the upper body. So the back is made up of some superficial muscles, and those muscles are your latissimus dorsi, your trapezius muscle, and your deltoid muscle. So superficial means that it's the one right on the top, and below that are the other deeper muscles. So first we'll start with the shoulder girdle, and that is made up of the levator, scapula, the rhomboid muscles, the trapezius muscles, the pectoral muscles, and the serratus anterior muscles. So let's go through each of those muscles. So your trapezius muscle, will start there. It's the one most superficial. It is a triangle shaped muscle, and it has its origin in your occipital bone on your skull. So at the top here is where it attaches. It also attaches on your clavicle on the side. Then it attaches to your vertebra, and then lastly to your shoulder, your scapula, your shoulder blade. Okay, so it's a big muscle that goes on the top. Below the trapezius muscle is the rhomboid muscle. Okay, so the rhomboid muscle, turn around, show you where the rhomboid muscle is. The rhomboid muscle is here. Okay, so this is your trapezius muscle, the most superficial. Below the trapezius is the rhomboid muscles. Okay, the trapezius muscle is responsible for moving your head. Okay, your rhomboid muscles are responsible for moving your shoulder blades. Okay, protraction of your shoulder blades, so bring them together and moving them apart. Okay, then we're looking at the levator scapular muscle, which is somewhere here. It attaches to the scapula and it moves the shoulder blade up. So it moves it in an upward movement. Okay, the last two muscles are on the front of your body. Okay, so your pectorals are on your chest here, and your serratus anterior comes from the back of your body to the front, and it's called serratus because it is a serrated muscle. It divides up and it goes somewhere here over your ribs, right? So from the back over here, and those muscles are responsible for lifting up your arms, okay, for moving your arms, pectoral muscles. Then we move to the rotator cuff muscles. So the rotator cuff muscles are responsible for your arm movement, and there's 4 main ones. So on your shoulder blade, on the anterior surface, so meaning facing forward, but on your shoulder blade is your subscapularis muscle, and that muscle is responsible for medial rotation or internal rotation, so moving your arm towards the medial plane, so in, right? That's done by the muscle here. On the actual shoulder blade, so on the top of the shoulder blade, if you feel your shoulder blade, you will feel it has like a little arch type thing. Okay, that is like the spine of the shoulder blade. On the top of that little arch is your supraspinatus muscle, and the supraspinatus muscle works with your deltoid muscles, which are situated here on your arm, to make your arm abduct, so move away from your body. Okay, that's what those 2 muscles do. The other muscles in the rotator cuff, so below the supraspinatus, is the infraspinatus, below that little spine. The infraspinatus, the teres minor muscle, and the other one that we did, the subscapular muscle, right? And the teres minor and the infraspinatus muscle is responsible for lateral rotation, so moving your arm from the middle to out. Got it? Okay. So let's just revise those muscles. So the muscles in your shoulder girdle are made up of your trapezius muscle, which is situated here on the top. Below the trapezius, in the middle of your back, is your rhomboid muscle. Then you're looking at the levator scapular muscle, which is, or levator scapular muscle, which is here on your shoulder blade and up a little bit into your neck. And the last one is your serratus anterior, which comes from the back to the front, and the pectoral muscles in the front. Okay, so these are all the muscles that are responsible for moving your shoulder blades, obviously in the directions we discussed. Then the rotator cuff muscles, the four muscles, subscapularis, on the anterior surface of your shoulder blade. On the top, supraspinatus, infraspinatus, teres, minor muscles. Okay, and on your arm here is your deltoid muscles, which works together with your supraspinatus to be able to pick up your arm. Okay, abduction. The last muscles we're going to learn, the last three, is on your lower back. So your latissimus dorsi muscles are on the side here. So they span out from your vertebra and join up here into your humerus, here into your shoulder blade. Somewhere there, right at the bottom. So it's like a fan kind of a muscle. And that allows you to be able to move from side to side. So like you can move from side to side. The other muscle that is on your back here is your quadratus lumborum muscle. So that is situated somewhere here at the back, and it allows you to bend from side to side. So this muscle attaches at the iliac crest and then to the bottom of your spine and your ribs. Okay, that's why it causes the movement to bend from side to side. And the last muscle on your back is a very long muscle. It starts at the bottom of your back and all the way to somewhere to the top of your where your neck is. It's the erector spinae muscle. Right? It's a very long muscle, but it's also not a superficial muscle. It's very deep. It's close to the bone, but it's not a bone, right? Okay, so those are the three muscles. It's the latissimus dorsi muscle, which is here on the side, and that allows you to move your shoulder blades. So not bend from side to side, moves your shoulder blades. The quadratus lumborum allows you to move from side to side, and your erector spinae strengthens the back. It also allows you to move from side to side. Okay, so that is the anatomy of the back muscles, right? We'll go through them one more time. Turn around, let's go through them, point them out for you. Okay, so it's your trapezius muscle at the back, levator scapular muscle here. Then it's below your trapezius on either side is your rhomboid muscles. At the front of your body, your pectoral on your chest, pectoral and serratus anterior muscles. Yes. This on your arms, over your bones here are your deltoid muscles. In your neck, you've got the semicleidomastoid muscle, the big one on the side of your neck, right? Which we didn't mention. Then you've got rotator cuff muscles, which are in this area. So in the front of the shoulder blade, anterior surface, subscapularis. Then at the back, you got the infraspinatus, teres minor, and the what's the one on the top called? The supraspinatus. Okay, then you got latissimus dorsi muscle here. Below that, your quadratus lumborum muscles and your erector spinae going from the top to the bottom. Okay, so let's do some exercises to be able to stretch and engage these muscles, right? To feel exactly where they are. So let's start with the easy one, which is child's pose. And in child's pose, you're going to feel the stretch of the muscles. So you'll feel your deltoid muscles stretching. All the way on your back, your erector spinae muscles. Your trapezius muscles stretch. And your rhomboid muscles are also stretching out. So you can just feel that nice stretch. It also stretches your quadratus lumborum muscles. That is child's pose. Let's come up to a seated position. You can sit in easy seat. However you'd like your legs to be crossed. Okay, and then you can slowly twist to the left. So the left arm will come on the outside of your left leg. Your right arm, fingertips to the mat. Just stretch it out as much as you'd like. And let's look at some of the muscles that you are stretching here. What are some of the muscles you can feel stretching? So on this side, you're stretching your deltoid muscles on your shoulder, but on this side, you are engaging it. On this side, you should be able to feel the stretch of the quadratus lumborum muscles, which allow you to, it should be engaging on this side, and on this side, you should be able to feel it stretch. You feel that stretching? Okay, and let's come back. Let's go to the other side. So now it would be stretching on the opposite side and engaging on the opposite side. Yes. So you're stretching on now on the left hand side, engaging on the right hand side, stretching out the deltoid muscles here. And that also feels quite good. And one more muscle that you are stretching out is your serratus anterior muscle, which is from all the way from the back to the front. Right, let's come back to center. Stretch out your right leg. Paravita Janusirasana. So if we hinge at our hips and we bring our left hand over to touch our toes, we'll be stretching the latissimus dorsi muscles. You should be able to feel it on your back, stretching your latissimus dorsi muscles, engaging them on the side, right? The other muscles that, because we're stretching over, we are stretching the quadratus lumborum muscles and the erector spinae muscles. Those are the ones that are stretching. Let's switch to the other side. Okay, so put your hand over to try and touch your toes if you can. And you can feel that the stretch is a deep stretch in the quadratus lumborum. Latissimus dorsi, which is a superficial muscle, is also stretching. And your erector spinae muscles. Let's come back to center. Let's do cow-faced pose. So you're going to put your left leg at the bottom. Bring your right leg up and over so that the tops of your feet are on the mat. Okay, take your right hand, reach it behind your head from the top. Reach your left hand from the bottom. Try and interlace them. or hold on to your clothes. So now we are stretching out the pectoral muscles in the front. By moving our hands away, we are stretching out the pectoral muscles. We are engaging the rhomboid muscles in the center. Can you feel that? In the center, just at the bottom here. You are engaging those muscles. You're engaging the deltoids by putting it like this. Engaging the deltoid muscles on the top and stretching them at the bottom. You can feel that stretch at the bottom on the deltoid muscles. And in your shoulders, on the hand that is raised, you are engaging all your rotator cuff muscles. So infraspinatus, teres minor, your serratus anterior, and your supraspinatus muscles on the top here, right? Let's switch to the other side. Okay, so now it would be the left hand is raised, goes behind your head. The right hand goes from the bottom up your back. And now we are engaging our muscles in our back. So our quadratus lumborum muscle is engaging to keep our back straight. Erectus spinae muscle is also engaging. Okay, and now we should also, on the hand that is going down, we should be able to feel the stretch on the tricep muscles. Okay, let's unravel. Okay, come to a kneeling position. So your knees are hip distance apart. Okay, come to a kneeling position. You're going to stand up. Right. Let's slowly go into camel. So put your hands like you're putting it in your jean pocket. And slowly you're going to lean back. And this leaning back action will stretch out our pectorals, our serratus anterior muscles. And what is it engaging at the back? It's engaging, because our shoulder blades are going together, it's engaging our rhomboid muscles. Our trapezius muscles are also engaging, our deltoid muscles, erectus spinae muscles, engaging all those muscles just to be able to lean back. Okay, let's come up. So when we did camel, we stretched out the front of the body, which is the pectoral muscles, the serratus anterior muscles. Just by doing that action, we stretched it out, right? But what happened at the back? We had to engage our muscles at the back. Erectus spinae muscles, all the way from the bottom to the top, started to engage. We engaged in the middle here. Deep in the middle, our rhomboid muscles, our trapezius muscles, our quadratus lumborum muscles, all started to engage. Okay, let's lower to the mat. Okay, we're going to do bridge. So go flat on the mat, keep your knees bent. Okay, try and hold, reach your fingertips to your heels. Okay, you can engage your core muscles. It will help you to lift up your hips. So start to pick up your hips off the mat. And here again, interlace your hands behind your back. And that will start to stretch out your pectoral muscles, serratus anterior. And now it's engaging the muscles, especially here at the lower back, the quadratus lumborum muscles. Start to engage, and if your hands are interlaced, also your rhomboid and trapezius muscles engage. Okay, let's come back slowly down. Okay, let's come to easy seated position. This is also another position where our muscles start to engage. So our deltoids in this position are stretching down. Okay, but what is engaging at the back? Our quadratus lumborum muscles are engaging, and our latissimus dorsi and our trapezius muscles here at the top are all engaging, so that we're able to sit in this position. Okay, if we have to take a side bend, so put our left elbow on the floor and take a side bend. This will stretch out our quadratus lumborum muscles because it's attached from the hip to the spine. And let's try the other side. Just as much as you want to go. Okay, and you can feel that stretch there. Okay, let's come stand up. Okay. So bend your knees. Okay. Lift up your hands. Chair pose. And in chair pose, we are engaging our trapezius and rhomboid muscles to keep our hands up in the air. Our latissimus dorsi muscles here at the back are now stretching together with the deltoid muscles. So just go a little bit more back so that you can see the pose. Okay, so here now, keep it up. Your deltoid muscles are stretching, engaging your trapezius and your rhomboid muscles, and stretching out your, tickling you, stretching out your latissimus dorsi muscles, right? Okay, so let's look at the next pose, forward fold. And this will give a nice stretch to our erector spiny muscles. Okay. And to our latissimus dorsi muscles, because we're moving our hands away. So the stretch is going to be all the way down your back and somewhat also on the side here. And forward fold. Okay, come back up to standing. Right, we're going to do a little complex pose, eagle pose. Okay, so you're going to fold, pick up your right leg, twist it over your left leg, and try and hook it on the outside of your left leg. Okay, then you're going to pick up your right hand and twist your try and twist your right hand around your left hand. Eagle pose. Okay, and this is a good pose so that you can release your legs, because we're doing the upper body. Let's come to a kneeling position so we can show the muscles that are being stretched. Now you can feel the stretching of the rhomboid muscles, stretching the trapezius muscles, stretching the deltoid muscles. So everything there is stretching, including your tricep muscles in that pose. Switch the arms. The right one is straight, wrap the left one around it. Usually one wraps better than the other. And you can feel that stretch in between at the back. Just stretching everything out. Then release. Okay, put your hands on the mat and push up with your feet, downward facing dog. And in this pose, we are stretching out the deltoid muscles, stretching out the latissimus dorsi muscles, and we're stretching out the quadratus lumborum muscles, all in one stretch. Okay, but in this pose, there are muscles that are engaging, and those muscles are in your rotator cuff muscles. Okay, so when you put your hands on the mat and you're up there, you can feel the muscles on your shoulder blades engaging, but your deltoids are stretching. Your trapezius is also engaging. Okay. Lower to the mat. So put your belly on the mat. Good, and we come up into cobra position. And this is now engaging all the muscles at the back. So your trapezius, your rhomboid muscles, you can feel engaging. You can feel your biceps also engaging, keeping you up there. And let's come down to the mat. Let's come up into easy cobra, or let's do sphinx. So you can feel the engaging of the, now we're not feeling so much on our shoulders, right? But we're feeling it at the bottom of our back on our quadratus lumborum muscles. And we have to engage those muscles to be able to come up. So because it's attached at our hip and our rib cage, when we trying to pick up, they will engage to be able to move our back up. Okay, put your hands on your side. Yes, you can put your face on the mat. Right, and lift up your legs and your torso off the mat, locust pose. Pick your hands up on either side of the mat. And again, you can feel your rhomboids, your serratus anterior, erector spinae, latissimus dorsi, all of the muscles at the back engaging. Come down to the mat. And slowly come back up to seated. Okay, one muscle which we haven't done a pose for is the levator scapular muscle. Okay, so that we can work that, stretch that muscle with a neck exercise, right? So put your head, turn it to slightly to the left, and then put it down slowly. And if it feels good, you can use your hand to bring your neck closer, your chin to your chest. And you should feel the stretch on your left hand side going from your neck down into your shoulder blade. On your left hand side, are you feeling it?
I feel it here.
No, so let's try on the right, right? So you're going to turn your head to about 2 o'clock. Okay, now put your head down, reach your chin to your chest. And use your hand to pull your neck down. should feel it on the opposite end.
Yeah.
Okay, so if you're putting it here, you're feeling it on the opposite end, because that is now the levator scapular muscle trying to pick up your shoulder blade. Okay, the other thing the shoulder girdle is responsible for is shoulder shrugs. And when we do shoulder shrugs, we're using our trapezius and our levator scapular muscle. Okay, that is shoulder shrugs. Okay, so that is the anatomy of the lower back, made up of the shoulder girdle muscles. Can you remember them? On the front is the pectoral, the serratus anterior. What about the big triangle one at the back?
Trapezium.
Your trapezius. Below your trapezius is your rhomboid. Yeah, those are your rhomboid muscles. And then we looking at, that's the shoulder girdle. Then on the side here, the big muscles that allow you to move your arms are the deltoid muscles. The rotator cuff muscles are made up of your supraspinatus, infraspinatus, teres major, and the anterior surface is the subscapular muscle. On the back is your latissimus dorsi, which is your superficial muscle. Below that is your quadratus lumborum, and the muscle that is very deep that runs up and down the vertebra is the erector spinae muscles. So that concludes the video for the upper body anatomy.